Hello and welcome everyone to episode 4 of our podcast here at Mosaic Medical, where we make sense of personalised medicine for our listeners. In today's episode, I'm joined again by Dr Isobel Wilson, one of Mosaic's founding doctors, and we're going to discuss a baffling subject very close to my heart, the humble vitamin B12. Welcome, Isobel. When we decided on the podcast title, we both thought it should be called We Need to Talk About B12, because I think we really need to talk about B12, don't we?
Hi, Camilla. Thank you so much. And okay, I completely agree. B12 is absolutely something that we need to talk more about because it can present in weird and wonderful ways. B12 deficiency can affect different people differently. And the testing for B12 deficiency is also quite complex. And you can have normal B12 level, for example, but still be deficient in B12. And unfortunately, those are the kind of people that we often see at Mosaic because they might have had lots of tests with, their GP or other conventional medics, and they're not feeling right still. And actually what's being missed is a B12 deficiency, unfortunately. So yeah, really excited about diving into all of that with you today. It's definitely a juicy topic.
And I think it's so much more complex than listeners might realise. So
yes,
buckle in because it's going to be a very interesting journey, I think. So to start off with, I'd really like to go back to basics and essentially explain what is vitamin B12 and what does it, in very simple terms, what does it do in the body?
Yeah, so B12 is an essential nutrient, and what that means is we have to eat it in order to have B12 in our bodies. It's not something our body can just make from other nutrients, for example. And it's really important in terms of DNA production and making new red blood cells. So red blood cells carry oxygen all around our body, and B12 is a key nutrient for that process. It's also really important for our nerves. So our nerves are around our nerves. There's a myelin sheath, which is like this sort of fatty insulating layer that makes sure that our nerves can ping signals to other nerves. And if you don't have enough B12, then you can develop really quite significant nerve damage, which unfortunately can be permanent if it's been left for years and years. And then the other thing that B12 is really important for is actually creating energy and also for the making and recycling of our hormones, our neurotransmitters. And so this is why B12 can also affect our energy, our cognitive function, can very much affect our mood. So yeah, it covers lots of different areas. But interestingly, some people will, for example, present with an anaemia where it's really affecting their red blood cells, whereas other people might be deficient in B12 and have normal looking red blood cells, but actually what's affected for them is their nerves. Or some other people might have normal neurological function, normal looking red blood cells, and what the B12 deficiency, the way that it's affected them is actually by causing really low mood. So I think, there's not a nice textbook case of B12 that people always fall into. It can present in a few different ways.
Which is why I suppose it's one of those weird and wonderful diagnoses where it can be very subtle what's happening for the person and in a way quite easy to miss. So you mentioned anemia. That's something we could pick up just on a random blood test. Perhaps that's something you've organised for another reason for the patient. Energy levels, so people can have fatigue and low mood as well. Were there any other classic symptoms that you tend to notice in your own patients?
I mean, pins and needles, if people have got a B12 deficiency with neurological involvement, which is where it's quite serious, B12 deficiency. So typically you get pins and needles, which starts in your hands and your feet and moves upwards. So it affects both sides of the body. And that can obviously be quite serious. You need to have B12 injections for treatment of that. The kind of oral supplementation doesn't tend to work. But I think for other people, it can be mostly just a cognitive thing of brain fog and low mood, probably alongside fatigue. But that can be a difficult one, can't it? Because there's lots of different conditions where brain fog and fatigue is a problem. So you might put it down to, for example, another condition that they've already got. And because B12 testing isn't perfect, they could have normal looking B12 levels, but it could still be that B12 is an issue. So I think this is why this whole area can be quite challenging.
Yeah, no, really complicated.
pitfalls in presentation and testing.
So before we go into more of the details about things like depression, I really want to pick up on that later. I think it's really interesting what you've just said, that actually patients it can look like they've got a quote unquote normal B12 level on their blood test, but actually they might still be having genuine symptoms from either a suboptimal B12 level, a B12 deficiency, or even what we call a functional B12 deficiency. Could you explain a little bit more about the different tests and why sometimes people can have a normal level but actually still have a B12 deficiency?
Yeah, absolutely. So the first line test that's generally done for B12 deficiency is called a Serum B12.
Mm-hmm.
And that's an appropriate and good first line test for lots of people. And what it's looking at is both B12 that's traveling around in the blood that's active, but it also measures B12, which is in its storage form in the blood and is not actually going to be used. And for that reason, it's not necessarily the most accurate test for B12, and an active B12, which is just measuring the active usable form of B12, is a little bit more accurate. Having said that, it's still not 100% accurate, because you could have enough active B12 in your blood. That doesn't mean that you've got enough in other tissues. And so this is a problem with other nutrients as well, where you're testing for it in the blood, but that doesn't mean you haven't got a B12 or other nutrient deficiency in, for example, your nerves or your brain. And that's where you can do a really fantastic test actually called an MMA test, which looks at if you have a functional B12 deficiency. So there's a substance called MMA, which builds up in the body unless it's converted to something else by B12. So if you have enough B12, MMA should be converted to something else. If you don't have enough B12, that MMA builds up, and that's a sign that you haven't got enough B12 to power your normal biological processes. That can be a really helpful test to do if you've had a normal or sort of borderline B12 level and you're still worried about B12 deficiency because of someone's symptoms. And MMA can also be done actually if you're on supplementation, to give you an idea about B12 deficiency, whereas blood levels of B12, both serum and active B12 are really quite unreliable as soon as you're on supplementation, and potentially for even 3 months after you've been off supplementation. And I think lots of people probably are on supplementation of B12, aren't they? Because it's in multivitamins, complexes that people might take for better energy, complexes that people might take for menopause support. So yeah, I think that's probably a important thing to recognise as well, that can make the tests a bit less accurate unless it's an MMA.
And it's often fortified in various types of food as well. You get those green drinks that people are having that might have a little bit of B12. So there are lots of reasons why that could skew your blood test results. But I think that's so fascinating to zoom out and realise, okay, when you're looking at a B12, it's not just about what is floating around in your blood, because essentially there are different types of B12. They're the ones that they're only there to be in their stored form. They're not actually working. They're kind of off duty in a way. And then you've got the ones who are on duty, but maybe they're being inefficient and they're not even getting into the office. They're just hanging out outside in the smoking area, but not actually doing any of the work. So you need to look at the whole picture, see like how many staff you have, but also, do you have the staff in the office doing the work that you want them to do? And the MMA, I suppose, in a way, isn't a test for B12, but it's a byproduct that shows the overall efficiency of those hardworking staff doing their job.
Yeah, I think that's a fantastic analogy. And actually, there is one group of people where MMA should be the first line test, so the first test that's done. And that's people who've been exposed to nitrous oxide. If this is not nitrous oxide, also known as laughing gas or NOS, so people obviously might take it recreationally. But the other group of people who might be affected by what might be exposed to nitrous oxide are midwives and anaesthetists who are giving it to their patients. And obviously it should be, it's on a mask on someone's face, but actually it's not a completely closed, perfect system. So it can leak out, be in the surrounding air. And we have had patients at Mosaic who have been in healthcare and have a B12 deficiency because of nitrous oxide. And the way it affects B12 is it actually inactivates part of that B12. And so really that doesn't show up then. If you're doing a serum or an active B12, it's still it's still there. It's still floating around. The level's going to be completely normal, but the B12 can't be used. It can't actually get into the office, to use your analogy. So that's why you'd want to use an NMA first line if you're a midwife, anaesthetist, or if you take nitrous oxide recreationally.
That's mind-blowing. So it's almost like you've got the active B12, you've got the staff members, but they're on strike and they're not. So that you're kind of counting them as people who are on duty, but they're not even doing the work. And to realise that actually there are people, just because of their jobs, who are more vulnerable to that, and perhaps they're going and having B12 levels tested and they're being reassured, no, don't worry, your pins and needles, your fatigue, your headaches, whatever you're having, has nothing to do with your B12, but actually you're testing the wrong level because of the nitrous oxide.
Yeah, and I'd be interested to know, actually, from your kind of perspective, having worked as a GP, about if you ever sent MMAs off, because I'm not sure it's a test that's known about that well, and it is in the national guidance now, and it is in the British Hematology Society guidance, but both those sets of guidance were updated in 2024, and it's obviously very difficult to stay up to date with absolutely all the new guidance that comes out. So I'm still not sure if it's a test that's sent off as much as it should be in the community.
No, I wouldn't get involved in B12 unless the blood level was red and said, yep, there's an actual low B12 level. And then I loved when that happened, because patients would feel so much better when I prescribed the injection for them, and they'd come back saying, oh my gosh, you've changed my life. I feel amazing. And that's such a lovely feeling as a doctor, to feel that you've actually
It's a rare silver bullet, isn't it?
Yeah, really rare silver bullet. But for everyone else, I always felt really stumped, because I had never been taught to do anything else. And I would just have to say, it looks normal. It's probably not your B12 then. And now I'm kicking myself, because actually it could still have been related to that for a lot of people potentially. But for anyone listening in, if you work in a dentist office, or you're an anaesthetist or a midwife, or perhaps you've needed to have several procedures with laughing gas, and you're feeling tired and you're having kind of brain fog, non-specific symptoms, regular headaches, don't assume that your B12 is completely optimum.
Yeah, I think that's right. I mean, if you've had it as a one-off, then you'd be very unlikely to be B12 deficient from a one-off exposure, because your liver should have about 3 months worth of stored B12. But you're right, if you've had its exposure over time, that's when you're at risk. And, you can go and chat to your GP about it, and it's in the NICE guidance. If you're in England or Wales, or if you're in Scotland, the British Hematology Society guidance could be used quite a lot up here. It's in there as well. So it should be a test that you can get through the NHS.
Perfect. I think that's really, really helpful to know. So we've talked about some of the kind of fancier tests and the being on shift and strike and all of those reasons. But if you actually just look at the serum blood test level, I know some countries have different cutoffs for what they consider to be normal, and actually the UK has a relatively low level. Could you explain us a bit more about that?
Yeah, so it's really interesting looking at normal ranges and how big or small those normal ranges are, especially compared to other countries, like you said. So in the UK, and this has changed in the last couple of years as guidance has been updated, but we used to have a huge normal range. And actually, there's probably quite a few people who are sitting right at the bottom of that normal range that were actually deficient in B12, but reported as normal, no issue. And the new guidance from NICE, anyway, which is the National Institute of Clinical Excellence, we basically now have a kind of, for serum and active B12, they stratify it into 3 different groups. So you've got less than 180, for example. If your serum B12 is less than 180, highly likely to be associated with B12 deficiency. If you're between 180 and 350, that's actually indeterminate. So you need to think about second line investigations, including things like the MMA. And if you're above 300, you're probably not. It says unlikely deficient, but it's not saying you're definitely not. And actually, for optimal health, you probably want to aim for serum B12 level of 500 or more. So that's what I tend to aim for all my patients, particularly in patients who've got fatigue issues,
and I know
or neurological symptoms.
Yeah, no, definitely, and that's closer to the range that they aim for in Scandinavia, because it was noted that actually from an epidemiological point of view, patients who aimed for closer to 500 were less likely to have cognitive impairment and dementia later in life. And so as a public health measure, it was just felt that it would be logical to try to do everything you can to optimize the population's health and prevent cognitive decline. So why not aim for a slightly higher B12? It makes so much sense. And I wonder if that's one day going to change in the UK as well.
Yeah, I think it will do. I think there's more and more discussions about the prevention of Alzheimer's and actually looking at markers associated with B12 deficiency, particularly a marker called Homocysteine, which is another marker which, if raised, can suggest a B12 deficiency or other B vitamin deficiency. Optimizing people's homocysteine levels is associated with less risk of dementia, Alzheimer's specifically. So I think that's really trickling into the public consciousness a lot more now. And I really hope that, I think another big topic, but we obviously have to do much more to prevent Alzheimer's as well. It's such a huge problem. Yeah, such a significant burden of chronic disease. So B12's a part of that.
And I started by saying that this was a subject close to my heart because, just for a little bit of context, I started off as a patient with Mosaic Medical before becoming a colleague, and I did that through the breast cancer service. Because of my family history of breast cancer, I wanted to proactively look at things that I could do to reduce my own risk, and we picked up that I had lots of nutrient deficiencies or kind of functional deficiencies. Basically, a lot of my nutrient levels were suboptimal despite a very nutrient dense diet, and we really couldn't work out why that was. And slowly with some genetic testing and a few other clever bits and pieces, we've understood how everything interlinks. So on that, could we talk a little bit more about the genetic side of things and why B12 is important for a big scary word, which still confuses me now, methylation?
Yes, it's a big topic, isn't it? So methylation is kind of a really key biological process. And what it really involves is sticking a methyl group onto things, which can turn on and off biological processes. And it's particularly important for how we create energy, how we create and recycle our hormones, our neurotransmitters, how we repair our DNA. We all have slightly different genetics when it comes to our methylation cycle, which means that some of us might be more vulnerable to methylation issues than other people, which means that we might be more risk of, for example, having DNA damage or having poor energy or having hormonal problems that are related to methylation. So, our cancer doctor, Amy Walker, she does a lot of genetic methylation panels with her patients to really try and understand, okay, where are people's vulnerabilities and how can we really personalize diet to make sure that we can optimize all the nutrients that you need for your methylation cycle. Because methylation, B12 is a really important nutrient to help the methylation cycles run, but also folate, zinc, magnesium, B2, B6, choline, all of those nutrients are important as well. And they all work together to make sure that methylation runs properly.
And in my case, it was really relevant because when it comes to your risk of breast cancer, how your body processes the sex hormone estrogen is really important. You need to be able to clear it appropriately. And if you've got too much of it lingering and you're not clearing it out of your body appropriately, then that increases your personal risk of breast cancer. And that's precisely what was happening to me. I'm very good at the first stage of estrogen detoxification, but sluggish at the second stage. And by optimizing all of my methylation through appropriate nutrients that impact it, I know that I'm going to essentially oil the machine that helps me clear estrogen appropriately. So that just gives some people listening in a little bit of context to the wider impact on your health. And that's only one example, but it's a really important example.
Yeah. And I think that estrogen side of things is fascinating. So the stage 2 detox that you mentioned is all to do with methylation. And the other kind of group of people who might be affected if you have a kind of sluggish methylation of estrogen is people who also have PMS, so premenstrual syndrome, potentially fibroids as well, which can be associated with poor, or can be partially driven by kind of poor detox of estrogen. So yeah, it's sort of, as you start going into B12, you realize that it has its fingers in so many pies. in the body, and that's why I think it comes back to what you said at the beginning, that it can present in different ways. Because it might be that actually the way your B12 issues are presenting is more with the hormonal side of things as well.
Exactly. And this is why we said we need to talk about B12, because actually the knock-on effect, it's like a domino effect, or like a ripple effect really throughout the rest of your body. It has so many knock-on effects and influences that actually on first glance you think, oh, it's just a humble vitamin, it's not that big of a deal, but actually it's a big deal, and that's why we need to talk about it. Definitely.
Yeah, absolutely.
So the other thing that was interesting in my case was that I've always had a slightly low folate, which makes no sense whatsoever, because I eat, for anyone who knows my Instagram account, What Your Doctor Eats, I eat a huge amount of folate in my diet, and I've actually always done that. And this was picked up when I was a medical student. And I always remember my GP basically just told me, well, you're a medical student, you're probably just not eating enough folate. But actually I was.
Yeah.
Dr. Amy and I did some digging, tried to figure out, okay, do I have genetic problems absorbing folate? Creatingly, I don't. I actually have perfect folate genetics, essentially. And so that was really confusing. But long story short, we realised I have lots of genetic issues with my B12, and that then has a knock-on effect on my ability to recycle folate and has made me vulnerable to low folate, which then will have a knock-on effect on your health in lots of other ways. And we won't go into that because I think we should have a whole separate podcast just on folate and why it's important for your health. But yeah, I think people listening in might not realise that there are individual genes that can affect your ability to absorb B12 and also to use that B12. And for those individuals, actually a more personalised approach means that, in my case, I might need to aim for higher B12 levels than other people who have better B12 genes.
Yeah. And I think the really cool thing about the methylation testing is that if you identify genes that, where you've got particular vulnerabilities, most of the time those genes are actionable, aren't they? Because you can say, okay, well, I know what I need to do. I need to increase my intake of B12 rich foods. I need to maybe increase my intake of choline, for example, as well. So it's not, we're not talking about genes where you're bad luck, you're stuck with them for life. There's nothing you can do about them. Actually, if you understand what's going on, there are ways that you can modify those processes, which is what you want, isn't it? You want to be empowered with your health and not think, oh, I've just stuck with rubbish genes, there's nothing that I can do about it.
No, and actually with those genes, you have to remember the reason that they exist is because, as a general rule, a lot of them will have had some kind of advantage, otherwise evolution would have cleared them out. And one of them definitely does have an advantage. It's your the FUT2 gene. So I've got a SNP that means, yes, it makes me less efficient at using B12, but on the other hand, it also makes my gut a more hospitable environment for a diverse microbiome. So it gives with one hand and takes with the other. And I'm quite happy, as someone who's obsessed with the microbiome, I don't mind having slightly less B12 efficiency if it means I'm going to get a more diverse microbiome.
Yes. Yeah, no, I love that. It's so true. Our body is not trying to damage us or harm us. It's there for a good reason. And it might just be that now there's a bit of a mismatch between actually our environment and our genetics. And that's kind of part of the problem here.
And in terms of reasons why someone could develop a B12 deficiency, we've touched on, okay, maybe genetically, like me, you're a little bit more vulnerable, and so you need to think about it. What other factors could make someone develop a B12 deficiency in the first place?
I think the group that everyone probably knows about is if you're plant-based, because you can't get good levels of B12 from plant-based foods. So the main sources are meat, dairy, eggs. I think probably that group of people is actually quite aware of the fact that they are prone to B12. So they might be more likely to supplement than other people. So the next group of people that are vulnerable to B12 deficiency are people who have low stomach acid. And you can have low stomach acid actually for a variety of reasons. Interestingly, when we're under stress, and that might be emotional stress, or it might be physical stress because we're unwell physically with something, or your output of digestive enzymes and stomach acid can actually go down because your body is prioritizing functions for survival. If you run it from an evolutionary perspective, if you're running away from a saber-toothed tiger, digesting proteins is not the priority. So the other thing that can really impact stomach acid levels as well is age. So the older you get, the more likely you are to have lower stomach acid levels. And the reason that that's important is because your stomach acid is what breaks down proteins, but also absorbs B12 from the,
Of course. And that's actually something that a lot of people probably don't even think about. We just sort of assume that your stomach acid is doing what it's supposed to be doing, but there are reasons why it can be low. And also on that, I know you're probably about to bring this up anyway, but medication can have an effect on stomach acid.
Yeah, and two really commonly prescribed medications as well. So if we think about proton pump inhibitors, which are used for if you've got issues related to kind of gastritis, or if you're on certain medications, then to protect your stomach lining, you have to be on a proton pump inhibitor. But it's worth knowing that in the long term, they can actually, suppress your stomach acid production and lead to a few different nutritional deficiencies, actually, including B12 and magnesium. So it's not to say that everyone on PPI should come off them, but I think it is really important that if you are on a PPI that you review it with your doctor regularly to see whether you do actually need to stay on it, because sometimes people can be put on them and then left on them for years or sometimes decades, actually. The other medication which can affect your absorption of B12 is metformin, which is a really common drug used for diabetes. And then I guess another group of patients who are vulnerable to poor absorption from stomach acid is actually if you've got an autoimmune gastritis. So this is an autoimmune issue which specifically affects part of your stomach that releases something called intrinsic factor, which is what specifically helps to absorb the B12. And if you have an autoimmune illness that you already know about, such as celiac disease or type 1 diabetes, or you've got an underactive thyroid, you are more likely to then be at more risk of developing an autoimmune gastritis. And I think that can be really problematic, because if someone becomes more fatigued, generally not feeling that well, it can really commonly be put down to the autoimmune condition that you've already got. So I think it's really important to be kind of if you're one of those people who's got a pre-existing autoimmune condition, to just be really aware that this is something you're more at risk of developing, and you might want to consider kind of doing testing that's above serum B12 or active B12 if you really are suspicious that you've got a B12 deficiency.
And that's actually how we came up with the idea to do this podcast, because in our first podcast episode, The Secret Life of Your Thyroid, you pointed out that patients with Hashimoto's, which is the autoimmune underactive thyroid condition, will often still have fatigue even though their blood tests look normal, and you do everything you can to optimize thyroid function, and still they've got ongoing fatigue. And then in the end, amazingly, you work out that it's the B12 that's an issue, and you said that's when you correct that's what really moves the needle for your patients.
Yeah, I've definitely seen that so many times now, that actually it's been Hashimoto's, which is the most common cause for an underactive thyroid, plus an autoimmune gastritis, which affects your B12 absorption. So yeah, I think a really interesting group of patients. I think the other people who are at risk as well is if you have surgery around your stomach or around certain parts of your small intestine, where you can also be at risk of not absorbing B12.
The one that we were talking about a little bit earlier that I think will very often be missed, and you mentioned, was SIBO as well.
Yes. Yeah, you're right. Other gut issues that's not necessarily celiac or related to surgery. SIBO is when you have an overgrowth of bacteria in your gut, and specifically in the small intestine. Those bacteria like to munch down and use B12 for their biological processes. So actually they can be using up the B12 that you would normally use. If you have IBS in particular, that's really commonly associated with SIBO. It would definitely be worth thinking about getting a SIBO test if you can. You can try and get them through the NHS. Depending on local guidance and gastroenterology departments, you might be able to get one on the NHS, but I think often something that people, unfortunately, at the moment have to do privately.
Yeah, but it's definitely worth doing, because when it comes to nutrient deficiencies, on the one hand, yes, in the meantime, while you're trying to work out what's going on, you can briefly use supplements. But ideally, you want to be able to optimize your body so that you don't need supplements. And that's where I think sometimes we can miss a step, because you don't actually end up going and looking for the underlying root cause of what's causing the problem in the first place. And if you just corrected that SIBO, your body would be able to potentially absorb B12 appropriately, and then you wouldn't need to rely on supplements for the rest of your life.
Yeah, exactly. And that's a reversible cause, isn't it? So if you can pick that up, then yeah, you can hopefully fix the issue.
So I think that's been just so fascinating already, just to understand some of the context and the wider causes that people could be thinking about. And I know when I was a GP, I definitely wasn't thinking about all of those things. Are there any other specific groups of patients that we haven't already mentioned that you think more about B12 deficiency in than maybe other patients?
Yeah, definitely. I mean, patients with chronic fatigue. And I guess that's the kind of bulk of who I tend to see in my clinic is people who've got kind of fatigue, which has not been fully explained. And undiagnosed B12 deficiency can definitely be part of that. Chronic migraine as well, as there's the standard neurological symptoms that we've spoken about in terms of nerve pain, but there's other neurological symptoms such as migraines or brain fog that could be a presentation as well. And then also depression or low mood. And I mean, that's if you find that and fix someone's low mood with B12, there is nothing more satisfying. It's only happened to me twice, but these are both patients where they'd been told they needed to go on antidepressants, and actually what they had was a low B12 level. And it's just so easy to correct that. You just start the B12 therapy. But unfortunately, it is something that has been missed. And I think there was a tragic case recently. A young lady died of depression, and actually it was found on autopsy that she had low B12 levels that hadn't been picked up.
Yeah, and her father is actually an orthopedic surgeon, and he campaigned and made sure that it was reviewed because his daughter was a vegan and wasn't taking any supplements. And the fact that the coroner's inquest actually agreed, yes, that was probably one of the underlying drivers of her suicidal thoughts is really eye-opening, actually, because that's not something that we've ever openly acknowledged before, that B12 could have such an extreme impact. So for anyone listening in, I think that should really drive home the message that when it comes to depression, we're moving away from previous beliefs and outdated views that your body and mind are separate from each other. Actually, there can be lots of underlying tangible triggers and causes of depression. We typically refer to them as organic causes, but as a general rule, having worked as a GP, I wasn't appropriately, now in hindsight, thinking about it, I wasn't thoroughly screening all of my patients for potential organic causes, because you've only got 10 minutes. That's not really what I was trained to do. And I would spend much more time talking about other things like, are you doing enough exercise? What's going on in your life? What stress are you under? Okay, let's organize some CBT. Let's start an antidepressant. When really I should have been looking for other potential causes, and B12 is only one of them.
Yeah, no, it's really interesting, and it's so tragic as well when that's missed, because it is something that is fully reversible and treatable. And actually, that if it goes undiagnosed for a long time, it can be that people get permanent kind of nerve damage and complications. But if you pick it up fairly quickly, then actually you can make a complete recovery without any long-term effects.
No, it's incredible. So when it comes to treating a B12 deficiency, if people are able to eat animal products, then which are the kind of best bang for buck B12 foods that you would go for?
Best bang for buck is definitely liver. And most people are a bit horrified about that. I think in our culture, we don't tend to eat lots of offal nowadays. So kidneys, another great source of B12. You can obviously disguise offal really well if you eat things like haggis, because it's got lots of other nice herbs in. For some people, though, it's still just not something they want to think about or consider. And in which case, other meat or dairy, eggs, those are also good sources of B12, and actually oily fish as well. So if you eat a couple of portions of oily fish a week plus some dairy and some eggs, you've probably got your B12 requirements covered, obviously depending on your other factors like how well you're absorbing it. If you are plant-based, then you need to supplement, and I would definitely say that you need to make sure that if there's any suspicion of B12 deficiency, that you really look into that a bit further. So you might want to, as we talked about, the NNA test being more reliable if you're on supplements, you might need to increase your dose of supplementation. And I think if you've got neurological effects, such as the tingling, or potentially if you've got migraines or brain fog as well, then you also want to consider about how you're going to treat that other than diet. And you might want to consider in those cases actually B12 injections. Whereas for other people, say actually if you've got depression, it can be sometimes okay to just up the oral supplementation. So the treatment kind of can depend on what's going on, but there's definitely different options. And sometimes people do need quite regular B12 injections, particularly if they're really not able to absorb it from their stomach because they, for example, have got an autoimmune issue or they've had surgery to their stomach or their gut. And in that case, people might be on injections long term. Whereas for other people, you might be able to just treat it with foods and a short period of kind of oral supplementation.
Okay. That's really actionable advice. And actually, I think liver, like you say, it's not culturally one of the most popular things to eat in the UK. It is in Denmark. So I live in Denmark, and eating pate is one of the most the common
and
common
pate is
foods.
delicious.
It is delicious.
A lot of people like pate, actually. That's a good point. You should definitely do a good pate recipe on your Substack.
I should do, actually. It's funny because I was speaking to a friend here recently about something else, about iron deficiency. And I found it so interesting that her GP actually said to her, well, I mean, are you eating liver? And she wasn't. So they said, well, start having some pate. And she started doing that, and that actually made a difference. At the back of my mind, I was thinking, but it was probably helping your B12 as well. So I love that actually doctors can still use a food first approach, and it can actually make a big difference. And perhaps for anyone listening in, if they do eat, if they are an omnivore and they are happy to eat a little bit of liver, try some pate every now and again, because it could be quite a helpful way to get some extra B12 and iron in.
Definitely. I think we should always try and use a food first approach if we can, with the caveat that if it's a severe B12 deficiency, we need to treat it much more aggressively. But long term, I think we all need to aim to have, if we're omnivores, we all need to aim to have regular consumption of B12 containing foods, because it is such a key nutrient.
Yeah, no, definitely. So I'm just going to summarize what we've covered, because actually it's a huge amount that we've touched on. So first of all, B12 is something we need to start talking about more in public, but also in the world of medicine, because actually it's something that historically has been kind of not looked at in a huge amount of detail unless it was very, very, very low. But people could still be experiencing chronic symptoms from a functional B12 deficiency, even if technically they've been told that their B12 level is quote unquote normal. Some of those symptoms could be the typical ones that we're taught about at medical school, like the pins and needles in a glove and stocking distribution, which just means you're getting them in your fingers and in your feet. It could be things like fatigue, brain fog, low mood, and even things like migraines and headaches that you just can't get to the bottom of. Optimizing your B12 could potentially make a big difference there. We also know that for people who have other autoimmune conditions, they might be told your fatigue is actually just related to, for example, your underactive thyroid. But in that case, if you do have an autoimmune hypothyroidism, don't forget that you are more vulnerable to other autoimmune diseases, such as the pernicious anemia or autoimmune gastritis. So patients need to be looking at their B12 in that case as well, because that could be one of the other things influencing their B12. We talked a little bit about why people could have low B12 or low functional B12, and we went from crazy reasons like having too much laughing gas, perhaps because of your occupation. And that means actually the staff, if your B12 is staff, you've got the staff who are off shift. Those are just the ones that's your B12 who are just going to be in storage. You've got the ones who are on shift. Some of them are actually going into your cells and doing the genuine work, but they can also go on strike if they're being exposed to nitrous oxide. So you need to look at all of those B12 levels in more detail to understand how the B12 is working for you. There are reasons in your gut, other reasons why you might not be absorbing it appropriately, like that low stomach acid or perhaps SIBO in your small intestines. You might be like me and have certain genetic reasons why you're less efficient at absorbing B12. And the big takeaway for everyone is the reason we need to talk about this is it has a wider impact on your long-term health in ways that perhaps listeners might not have thought about. So it can affect things like cognitive impairment and dementia. And that's why in Scandinavia, we aim for higher levels than in the UK. And perhaps that's something that's going to happen across the world as we become more interested in preventative medicine, but also it could have a downstream effect on that big scary word, methylation, how your body interprets your genes, and then influencing things like your hormonal clearance, in my case, like my estrogen clearance, and that can have a knock-on effect on even things like breast cancer. So it's a huge web that's impacted by this humble little vitamin B12, and you can be plant-based and still supplement, and that's absolutely fine. But we always meet patients where they're at, and we're never going to tell them to completely change their lives, but you have to make sure that you're appropriately supplementing and actually reaching the right level. But for people who are omnivores, they might want to rethink where they're getting their B12 from if their levels are suboptimal, and simple things like oily fish and a little bit of pate could make a huge difference. Do you think there's anything that I've missed out, or looking backwards, there's something you wanted to mention that we haven't covered?
No, I mean, excellent summary. I'm impressed. I think the main thing that I wanted to just, point people towards is a couple of resources. So there's a really fantastic charity called the B12 Society who do a lot of education, both for patients, but I think if you're a doctor, it's a really fantastic website. So highly, if you're interested in this topic, I really recommend checking out their website because they've got like much more information about B12 deficiency and including testing on there as well. And then if you're worried that you have got a B12 deficiency that's undiagnosed, and have a look, you can have a look at the guidance in your area, and it might be that you qualify for tests such as the MMA, so you can look up the NICE guidance, for example, and you can go and chat to your GP about that, and it might be something that you can get a complete workup from on the NHS. But obviously if there's ongoing concerns, that at Mosaic, that's the kind of thing that we can help people with as well.
Yeah, and I'll pop details to the Mosaic Medical website. So if anyone does want to have a chat with us, you can actually book a free discovery call to talk to one of our doctors, so we can explain a little bit more about the service and what kind of testing we might be able to help people with. Brilliant. I think that's been such a fascinating subject. I'm so happy we finally talked about it, and I think there are loads of things to take away from it. So thank you so much, Isobel, for joining me again.
Pleasure, Camilla. Thank you.